Hello, Diaz here, founder and owner Greenwood Dental. Welcome to another episode. Today, I am discussing the concept of interproximal. Interproximal meaning that, or refers to, any spots between the teeth. One of the challenges that I find many of you have is the understanding of cleaning interproximal. Some of you would say, oh, I brush twice a day, I brush every day, I don't know why I'm having cavities or I'm getting cavities. And the reason why is the lack of using tools that can go between the teeth. Now, keep in mind that the toothbrush will brush the front and the back of the teeth. It does not go in between. It's not an interproximal tool. There is no way for you guys to get it between the teeth, no matter how hard you brush your teeth. So you need different tools to get between the teeth, which is like floss sticks, soft picks, water pick, or floss. Again, floss as the string that goes between the teeth, which is an amazing discovery, an amazing invention. I don't know who stumbled on it. Honestly, I don't even know the history behind the floss and how the floss got incorporated into the everyday or daily home care or oral hygiene routine for humans. But the concept is to try to get something between the teeth, because the spots between the teeth are the blind spots, is where we not miss out, but a lot of things can happen. It's a dark spot. Sometimes it's a dry spot, and also we cannot diagnose it without x-ray to see in between the teeth what's going on between the teeth. Also, at the same time, remember, the gums wraps around the tooth, not only the front and the back of the tooth, but also it extends itself between the teeth. So for you guys not to use a tool that goes between the teeth, you have a lack of stimulation and a lack of massaging the area between the teeth to introduce a new blood flow, fresh blood flow to the area to keep the area nice and healthy. So when we ask you guys and we get eye rolling or frustrations about how challenging it is to use a floss, especially with my male patients that are over 6 feet tall and they have a very large hands, it's really hard for you guys to get back there and get the floss wrapped around the last molar. So instead of dropping the floss completely or not doing anything, pick up a different tool and ask us about what can you do to replace the floss. I hate to say it, but it is a replacement of a floss. And I'd rather you guys use something interproximal than not to use anything at all. So that is very, very important for you guys to prevent decay, to stimulate the gums, reduce bleeding, reduce sensitivity, and also it tells us how your routine is consistent with the findings that we see every time you come, every 6 months, 4 months, 3 months, recare appointments. So introducing those interproximal tools are very, very important, and it's significant to the health of the gums and significant to the health of the tooth itself. If you want to prevent decay, if you want to prevent any kind of condition that you don't want to hear about every time you come for your cleaning or your recare appointment, you have to incorporate interproximal tools to your daily routine other than just brushing. There are interproximal brushes or tufted end brushes that you guys can use, but again, those are very limited to small areas or tight areas, the front and the back of the tooth, and not interproximal. So I hope this helped, and I hope this video is useful and get you some kind of a reasoning or justification of why we emphasize the interproximal tools for you guys to, like I said, incorporate into your daily routine. That's it for now. We love you. Be safe, and DS out.